It's September the 8th, 2021, and it is Wonderful Wednesday and also chemo day. Well, this is my all-day chemo day, which I will be there for, I think 6 hours, six and a half. And then they will attach as far as the portable infusion pump, and I will wear that for 48 hours, which I've discussed before. Um, just to update you too, I had to go to the emergency room on Monday. I wanted to do a video then, but I was in so much pain and not feeling well, I just forgot. But I actually had to go to the emergency room because my leg, my left knee had gotten worse. It was bruising on both sides. One side looked blue, one side was red, and it was still swelling, and then it was getting tighter as far as for me to maneuver around, walk around. So my girlfriend Laisa and Fatia, my cousin, and my little cousin and I, they actually drove over from Lithonia, which is like 45 minutes. So thank God, they wanted to do that. They came and took me to the hospital. Now with the new COVID going on, the new variant, they wasn't allowed anybody to go in like they did previously when I was there in June or May, I forgot which one. But also, so I was, in the waiting room for a little while. Got a little, aggravated, as we all do when we go to the ER. But I've never had that issue when I went to this particular hospital, which is actually my favorite hospital. But they got me situated, got me in a room, and I told them what was going on and everything. And I told them, I had already saw my orthopedic doctor, and because the x-ray didn't show much, wanted to, have me to go have an MRI, which was scheduled, as I think I said in previous videos, on the 16th of this month. Well, with my knee getting worse and then, me seeing a bruising, I got a little scared, especially because I have stage 4 cancer. I didn't want no infection or anything. So, because my white blood cell count was higher than it should be for a cancer patient. It was due because maybe it was fighting off an infection, but now, it's went back down. And so they did the MRI, and they came back and told me it is a large tear in my meniscus. That's why it's hurting so bad. So I would actually have to have surgery on my left knee. So I have to go see my orthopedic doctor slash surgeon on Tuesday of next week. I think that's the 12th or 11th. So I have to go, and hopefully I could do a video, that day. But I have to speak with my oncologist today when I see her to find out, what's the best plan of action to go ahead and have the surgery. But also I don't want to miss out on chemo, so I need to find out, what's going on. But I do have to have it, corrected, because I can't walk, most of the time when it gets worse, and that's not a good thing. So just want to update you guys. I will try to do another video while I'm actually at chemo today, and also just talk about a couple things as far as with colon cancer, because I had a discussion with my book club on Sunday, and we talked about it, and I talked about as far as wanting to do a podcast and doing my videos every week and a couple times a day to try to, as far as, motivate people to go ahead and ask for to get a colonoscopy, and also be an advocate for yourself, just to make sure with anything that's going on with your body that don't let them tell you no, don't let them give you some excuse or tell you that, oh, this is that, and you kind of feel it's something different. You have to speak up. You have to be your own advocate. But I will be speaking to you guys later. So I hope you have a wonderful, wonderful, wonderful hump day, Wednesday, chemo day. And this is and just to go over, I have my fingers taped up because one of the things I told you, it actually, in the crease of my fingers, there's like holes in it from the Erbitux, and they burn. It's kind of like a paper cut times 3. So I have them on several fingers, so I put the second skin on it to cover it up, to try to heal it, and then I put the band-aids over it so I won't get them wet or mess with them. And then I actually have some other arthritis gloves that I actually wear over them to try to protect them, because I do have sores on the tip of my fingers as well, and that comes from, as far as Erbitux. So like I said, chemo is doing what it needs to do as of now, but Lord, it does give you a lot of bad side effects. So I'm pushing through. I was crying yesterday. I'm not ashamed to say, I told you that my attitude is positive, but the pain makes you cry sometimes, makes you, just want to be like, Arr! So yeah, so I had that for the last 2 days because it was hurting so bad, and then yesterday it was actually hurting in both of my legs and both of my knees, and it felt like it was, going down to my legs and, going down to my ankles and my calves, and it just was so bad. I had to take something and I had to just go to sleep because it was just awful. I even called my mother crying. I'm 46 years old, but that's what the pain does to you. So thank you for watching. And again, have a wonderful, wonderful Wednesday, hump day, chemo day. And this is from your sexy stage 4 colon cancer metastasized to my liver patient. Mwah.